I actually contracted TB when I was about 10 years old and was one of the few fortunate Indians who was diagnosed early, fully treated. It was very painful, lots of injections. But I then went on to become a medical student and saw the most horrific stigma, both among medical students as well as when I started practicing clinical medicine among fellow providers, and have spent the rest of my life trying to address and break down that stigma.
Talk about this stigma among providers. I presume this is because this is an airborne, easily transmissible disease and they're worried about getting infected. How do you overcome that?
Well, in medical school, what was very interesting was that many of my fellow students opted out of that TB rotation because they were afraid of becoming infected by other HIV positive as well as TB infected people. And I think a lot of it had to do with ignorance as well as gaps in the training of medical students while we were still in school. Had we been given the correct information before we went out on those TB rotations, we would have been more humane, more compassionate, and been able to also protect ourselves from becoming infected.
Does the problem persist, or has it been somewhat overcome?
It has become somewhat overcome. I think public awareness is much greater, education is much greater, but then again, women pay a very, very heavy price, more so than perhaps others in India.
Talk about that for a bit.
Well, like in Africa, women are caregivers, they're breadwinners. It's extremely difficult for women to go through a course of treatment for 4 to 6 months, and I know firsthand just how difficult that was, even in a very supportive environment. And when you look at women who have to go through those very long courses of treatment and also go out, work in the fields, take care of their children, etc., it's a very heavy burden to pay. You need to be adherent to be fully cured for TB, miss just 3 doses of rifampicin, and you may become drug resistant. So you need to be really, really careful and have a very supportive environment. And if the first thing you encounter is your provider with a lot of stigma, that's going to make that hill so much harder to climb.